Hi, my name is Darren Gray, and I'd like to spend just a couple of minutes just to talk to you about some services that we're providing that I generally think that will help you and your clients. Firstly, I ask you, what is your current evidence-based protocols for some of your neurological cases? For example, if someone comes in with MS, how would you approach them? I have no doubt that you are comfortable in seeing these patients with MS or Parkinson's or vertigo that come into your practice. But the complexity of these neurological cases do come with an interesting mix that are important to actually address these in a very specific approach. In my experience, I find interdisciplinary support and networking is actually generally quite poor. For reasons of having busy lifestyles or busy practices, often we all lead sole practices, so it's actually something that we don't necessarily have a priority for. Prior to my recent studies, I admit when confronted with challenging neurological conditions that I always defaulted to a safe environment. For example, vertigo clients. How often would you do a canal repositioning manoeuvre? Quite often, most of us, all of us, would do a canal repositioning manoeuvre for vertigo. But really, not all vertigo clients require a canal repositioning manoeuvre for vertigo. So what is the purpose of this presentation today? Well, I would like to introduce you a new service. The service that we're providing utilises video conferencing. It starts off with an appointment. Well, firstly, the patient makes contact with us, or yourself makes contact with us. They make contact either through Skype, email, or phone, and they contact Brainstorm Rehabilitation. Once we receive that call, we'll send out some introductory paperwork, questionnaires to complete. Those questionnaires will be received by us, and we'll go through those questionnaires, and then we'll contact the client. From there, we'll make an appointment, and that appointment is the special appointment. It's a video appointment, and that video conference will last about an hour and a half that we'll allocate. The conference will occur either at your office or even at the patient's home. It depends what either is comfortable with. At the conclusion of that, I'll actually reassess the paperwork and also the conference and organise a medical report, and that medical report will go out to yourself and also the client. A week later, another conference will be organised, and that conference will just go over the findings, the recommendations and advice that we'll actually identify from your examination. And any subsequent appointments that may be required or any further therapies will be organised from that particular point, whether it be at your home or whether it be at the providers. Thanks for listening to this short presentation. In the contact you'll find some information on the more information about Brainstorm Rehabilitation. Please feel free to go through the website www.brainstormrehab.com.au or contact us. Feel free to contact myself, Darren Gray, or any of our reception team.